Hello from Becky and me and welcome to the programme.
First tonight, the concerns about out-of-hours GP care raised by a health watchdog after a Cambridgeshire man was given a fatal dose of a painkiller by a doctor from Germany.
David Gray from Mayney near Ely died in February last year after Dr Daniel Abani gave him 10 times the normal dose of diamorphine.
Today, a report by the Care Quality Commission says primary care trusts need to do more to keep check on their out-of-hours services. Emma Baker has this report.
It's seen as a skeleton service, yet we rely on the GP out-of-hours system for the majority of hours in the week. Now, Watchdog says there's wide-ranging concerns about the quality of that service.
Our message to primary care trusts is make sure you're not just scratching the surface, make sure you're really digging deep, you're really looking at the quality of care that patients are receiving and that the systems are there to keep them as safe as can be.
The report's been prompted by the death of 70-year-old David Gray from Mayney near Ely. He was given 10 times the normal dose of diamorphine by a German doctor, Dr Ubani, who was employed by private firm Take Care Now. He was working his first out-of-hours shift for NHS Cambridgeshire. Within a few minutes, Mr Gray had died. Dr Ubani later admitted he was exhausted after flying in from his home country. He was given a 9-month suspended sentence in Germany for causing death by negligence.
I've got an issue with the systems that allow such a thing to happen, where untrained doctors are allowed to come in and practice.
Take Care Now still provides out-of-hours services for 5 primary care trusts, including 4 in our region. The report found the monitoring of the out-of-hours service varied from trust to trust. It says local primary care trusts need to keep a closer eye on their out-of-hours system. No one from Take Care Now was available for interview today, but in a statement it said it welcomes the interim progress report and is continuing to work in the ongoing investigation.
The system we have today began back in 2004 when most GPs opted out of providing out-of-hours service. So now different primary care trusts provide the out-of-hours service in different ways. Some use private firms while others use GP cooperatives.
One GP we spoke to in Cambridge said it's important patients have confidence in the system.
You need good local GPs who understand how the system works locally, so that it actually matches with what happens locally, so that what they do out of hours doesn't cause an impact in the day, but most importantly looks after the patients properly with what's available locally.
Local MP and Shadow Health Secretary Andrew Lansley says action needs to be taken now to improve the situation.
We've got a position where the primary care trusts have got this burgeoning bureaucracy, but they're not actually doing the job of finding out what quality of service is being provided and whether there are non-UK doctors, whether they actually have the right training and expertise, whether people are working too long hours. They should have been doing it and they haven't been doing it, and I think that's pretty shocking.
The Department of Health is now writing to all health trusts in England, telling them to urgently review the way they monitor out-of-hours services. All parties involved will be keen that the system doesn't fail any more of its patients. Emma Baker, Anglia News, Cambridge.
Well, earlier I spoke to Dr Paul Cosford from NHS East of England and started by asking him why, following the death of David Gray, they were still covering out-of-hours services in the same way.
Well, first of all, can I take this opportunity to offer my condolences again to Mr Gray's family for the tragic event that happened, and an apology on behalf of the NHS for the things that went wrong in his case. As soon as it did happen, we took a number of different actions to make sure that that tragic incident was as unlikely as possible to happen again. So we removed the diamorphine, which was the medicine that was used in his case, in the dose that it was available. We added extra safety checks to the use of that diamorphine in out-of-hours care. We boosted our induction programmes for GPs and others who are new to the East of England in providing out-of-hours care.
But today's
we did
report,
also ask the...
Today's report is the second time that the way that out-of-hours services is administered at the moment has been criticised. Surely we need to be looking at using different ways now.
Well, what we did do was to ask the Care Quality Commission to mount an independent investigation so that we could make sure that all possible lessons for us and also any implications nationally were learnt out of this incident. And so we welcome the interim statement. It's still work in progress from the Care Quality Commission, but what they have said to us is that it's crucial that we work better with our primary care trusts to make sure that the monitoring of the detailed quality of the service provided is stronger than it has been. We have made contact today with all our primary care trusts, and we will be working with them to make sure that their monitoring of the quality of care is as strong as it can be.
Dr. Cosford, we're going to have to leave it there, but thank you very much for joining us.
A teenager who beat a Northamptonshire man to death with a hammer after being accused of vandalising his car has been sentenced to life for his murder.
65-year-old Peter Bryan was just 300 yards from his home in Higham Ferrers when he was attacked by a gang of 5 men in November last year. He died from his injuries 2 weeks later.
17-year-old Ricky Anderson was told he will serve a minimum term of 9 years and 2 months after admitting murder. Matthew Hudson has just sent us this report from Northampton Crown Court.
Peter Bryan's widow Jackie, in the green cardigan, arriving at court with family and friends. He was, she told the judge, her rock, her best friend, her life. This is the teenager who ended his life, Ricky Anderson, a 17-year-old with a history of violent offences. His accomplices, his brother Jamie, Nicholas Riley, Darren Watts and Kyle Clinton, all had previous convictions for violence. Afterwards, Mr. Bryan's family was unhappy with the sentences and said more had to be done to curb out-of-control teenagers.
A devoted husband, stepdad, grampy, friend and colleague who had his life taken away from him just as he was about to embark on a well-earned retirement. When will our society be allowed to make a stand against these mindless acts and make our communities a safer place to live in?
The tragedy happened on November the 27th last year, after Mr. Bryan saw a group of youths apparently vandalising his car in Saffron Road. He followed them here to Vinehill Drive, around 300 yards from his house, and it was here that the gang turned on him. It was in this utterly nondescript alleyway off Vinehill Drive that Peter Bryan was surrounded by the youths and attacked. One of them was wielding a hammer which left him with such extensive head injuries that he died in hospital 3 weeks later. The vicious assault sparked a major police investigation. A number of youths were arrested shortly afterwards. The vicious assault sparked a major police investigation. A number of youths were arrested shortly afterwards. Although 3 of the defendants are juveniles, Judge Charles Wyde said it was in the public interest that they should be named. The police said Mr. Bryan's murder was a tragic waste of life.
It was tragic. Mr. Bryan was looking forward to retirement. He was very calm. I've actually listened to the control room tape of Mr. Bryan this morning before I came to court. And Mr. Bryan was clearly very calm, reported the incident very properly. And clearly there was no threat to these youths, as was portrayed in court.
Ricky Anderson, who was wielding the hammer, will serve a minimum of 9 years and 2 months for murder. The others received sentences ranging from 28 months to 12 months after admitting violent disorder or affray. Matthew Hudson, Anglia News at Northampton Crown Court.